Hello, my name is Carlos Dimas. Today we'll be discussing the global history of disease and colonial models of medical and public health education between the 19th and early 20th century by comparing colonial Southeast Asia to post-colonial Latin America, with a focus on how doctors and nation builders utilize the body and institutionalization of medicine as areas to build a nation and create proper citizenship. As humans forcibly and willingly came into contact, lines of trade opened, forever connecting areas. Outside of the trade of goods and people, bacteria and knowledge systems freely flowed. The introduction of bacteria destabilized the epidemiological ecosystem of entire regions. The arrival of smallpox, cholera, and yellow fever had a massive demographic impact on the native populations of Mesoamerica, while bubonic plague killed millions throughout South and Southeast Asia. Disease in the colonial areas of the globe created massive labor shortages, destabilized pre-established social and political orders, and left an indelible mark on the local culture. Colonial nation builders, imbued with incipient forms of nationalism, eugenics, and pre-established understandings of racial hierarchy, took these ideas and epidemics as opportunities to establish medical schools utilizing European curriculums. The Dutch in Indonesia, the French in Vietnam, and the Americans in the Philippines. While in Argentina, Buenos Aires doctors based their curriculum on French and German models of medical education to mediate between the state and the massive immigrant population populating the port city of Buenos Aires and the expansive interior. The French theorist Michel Foucault noted in his work, Discipline and Punish, and a History of Sexuality, that medical techniques and education were one area that foreign invasion was advanced. The curriculum taught in colonial medical schools imposed Western medical practices on local doctors in training, who would then be sent out to the peripheral regions of the colonial state. This created division between local and Western medical practices. Western medicine was seen as a way in which to civilize the local population, while local practices were often depicted as backward and barbaric. France was home to a variety of medical theories, one being degeneration theory. This theory held that in the late 19th century, the white race was slowly degenerating due to the growth of non-white races and the intermixing of whites and non-whites. The practice of Western medicine would seek to counteract this process. Medical schools and the training of native medical doctors became bases to advance Western civilization, subdue natives, and establish power in the state. During the late 19th century, European doctors discovered that the origin of disease were not miasmatic bad airs, but were tiny bacteria that invaded the body. In order to curtail the spread of disease and continue state authority, medical nation builders viewed the body as fertile ground to build proper citizens and inculcate people into the nation. Nevertheless, this new understanding of disease origin still carried ideas of race and racial hierarchy. During epidemics and medical events requiring the involvement of public health officials, doctors and nation builders established new ways to facilitate the state to control the public and private space. In the Philippines, American officials sent out Filipino sanitary workers to inspect homes to ensure they complied with American public health protocol. In the Mekong Delta of southern Vietnam, Dr. Bra's inoculation campaigns incorporated peripheral Vietnamese into the colonial bureaucracy. Bubonic plagues in Java and Batavia permitted Indonesian doctors to remove potential disease vectors, where they sprayed DDT in homes and burned them down and moved entire populations. In the Philippines and Indonesia, the after effects of the epidemics offered the government ways in which to establish regulations and housing constructions that were approved by Europeans, but conflicted with local practices. Indeed, regulations in the medical field stretched into other areas. Medical and legal discourse in early 20th century Argentina continually juxtaposed the country's liberal democracy with control, repression, and exclusion of undesirable citizens. Like the colonial governments of Southeast Asia, Argentine political and medical elites were distrustful of the masses. Thus, locals and immigrants that did not conform to health regulations were pushed out of the public sphere. The state viewed these bodies as potential threats to the state that would undermine its control. Thus, newly established institutions such as the National Department of Hygiene and the Maritime Sanitation Corps inspected and regulated incoming bodies and injected them into their first experience of Argentine state control. Throughout the globe, medical officials and nation builders worked in tandem to build a colonial and post-colonial state. Foreign medical models of education and public health initiatives became vehicles to exercise state power on the minds and bodies of locals. Young professionals were incorporated into state institutions in order to spread state power down at the ground level. This is evident during epidemics, the suppression of local practices, inoculation campaigns, foreign medical curriculum, immigration control, and the regulation and placement of intermixed children. As we can see, that whether in a colonial or post-colonial setting, the practice of medicine has been used to control the bodies during the building of a nation and the creation of proper citizenship.